A fountain? A doorknob?
And do you know if there's any truth in these statements?
Nice people don't get VD.
You can only get sick from a prostitute.
Perhaps no worse than the common cold.
Once you've had a dose and been cured, you're immune.
If you don't see any signs or symptoms on your sex organs in a week, you don't have it.
You can't get VD if you use them.
And have you ever heard or said,
It's no big deal from VD.
I know someone who had VD and it went away all by itself.
Stop worrying. Once the herpes sores go...
A venereal disease is punishment for committing a sin.
It's a dirty disease caused by doing dirty things.
well, what do you think? If you don't know the answers, it's probably because so many people are still too reluctant to talk about VD openly. And especially because too many people still think of VD as a disease caused by sex and not by a microorganism. What do you think? Well, is it sex or microbes? What causes VD? That wasn't intended as a trick question. It's the key question, and I hope the answer was obvious to you too. There is no way for the sex act in itself to cause VD. Microbes cause VD. So, just to make sure that ignorance of the facts will be no excuse, sexual relations are not the cause of VD, but it is the usual way VD is transmitted from one person to another. And before we go into the details, if anyone is embarrassed or self-conscious about what we're going to talk about, it would be interesting for them to know that not too long ago, people didn't say words like this out loud either.
Cancer.
Tuberculosis.
Epilepsy.
It was also considered poor manners to talk about these illnesses in public or in any kind of detail. If any one of you thinks a film on VD may be embarrassing, can you imagine yourself doing this to get the facts?
Dad, can I talk to you for a minute? I have a strange discharge from my penis. Do you think it can be VD?
Mother, I have a strange discharge from my vagina. Do you think it could be VD?
Or has this ever happened to you?
Son, I know you're still pretty young, but this might be a good time for us to talk about sex and venereal disease. Now, I'm not telling you to go out and have sexual intercourse, but, well, there are some things you should know about it. For example, do you know what a condom is? Well, a condom's a safety device. If you use it right.
Or has this ever happened to you?
You know, Kathy, things have changed from when I was your age. There are some things parents never talk to their children about, but I think more can be gained by talking about sex and venereal disease than can be gained by making believe neither exists. Obviously, I can't be with you always, so you've got to learn to make your own important decisions as soon as you're able to.
But how many of us have had our parents do that? I'm afraid there aren't too many parents who've explained the birds and the bees, and VD too. But we really can't blame them for that. We can almost be assured that their parents didn't give them the necessary information either.
You mean, you sure?
Also, for many parents, to talk about sex, let alone VD, is still too embarrassing.
I just don't understand. What do you mean?
Besides, VD is a medical problem involving information most parents don't have. Unfortunately, this same parental reluctance to deal with the problem of VD exists in some schools as well. This is usually the result of restrictive local or state laws or community pressure against providing this urgently needed VD information because of its sex-connected origin. What's the result of hoping you learn about sex and VD somewhere other than from parents or school? Some heavy problems, not the least of which is the present VD epidemic. This is probably the best time to say that this is not a film about sex, nor are we going into the morality of sexual behavior. That's something between you and the rest of the people in your life. What we are concerned about are the facts about VD, medical facts, facts to prevent, discover, and cure VD. With all that out of the way, this may be the best time to complete the answer to this question.
Is there more than one form of venereal disease?
To answer this and other medical questions, we will call upon experts. Is there more than one form of venereal disease?
Yes, Gail, there are many different kinds of diseases that can be transmitted sexually. In public health, we're primarily concerned with 3 diseases: syphilis, gonorrhea, and genital herpes. These diseases are very widespread, and they also can cause serious permanent damage to people that are infected. We'd like to talk first of all about genital herpes because it seems to be increasing very much in the United States, and it's probably the one that we know the least about. Dr. Colin Jordan is an assistant professor of medicine at UCLA, and he's also one of the leading researchers in the field of genital herpes. Dr. Jordan, just exactly what is herpes?
Herpes is a virus infection that most of us know best from cold sores on the lip. But what we're talking about today has to do with the genital version of that infection.
Okay, how would a person know if they got this genital version of herpes?
Well, usually it shows up as a crop of small, tiny blisters that appear in the genital area. Most frequently, these appear on the penis or in and around the vagina. But they're also frequently seen around the thighs or the buttocks or the lower portion of the abdomen.
Are these painful blisters?
They can be painful, although not always.
So would a person always know that they were infected?
Usually they're aware of them in that they're visible or they're painful. The only problem has to do with women where the blisters may appear inside the vagina and she may not be aware of them.
Okay, so if a person has these blisters or thinks they might have genital herpes, what do you suggest they should do?
Well, they should consult a physician basically for 2 reasons. First of all, genital herpes may mimic syphilis, and that's an important distinction to make because syphilis is treatable with penicillin and should be treated, whereas genital herpes does not respond to penicillin. The other major reason, though, is to verify whether or not, in fact, a particular person has genital herpes, because they should alter their sexual behavior and be aware of the problem.
Can a physician cure herpes?
Well, at the present time, there really isn't any cure for it. Sometimes things can be done to shorten the course of the sores. Usually they last on the order of 7 to 10 days, and they go through several phases, initially starting out with these small blisters, which then break down and make shallow depressions in the skin. And then they scab over and heal. Sometimes that phase can be shortened, but the major problem with the disease is that so far nothing can be done about preventing it from coming back.
I mean, the sores recur on a person?
Yeah, frequently that happens. There's a great variation in the amount of difficulty that people have with these sores. Some people will have them as frequently as every month or so, whereas others will have them scattered over several years.
You mean a person might catch genital herpes and not have it reappear for maybe 5, 10, even 20 years?
Right. That's an important point because I think it has to be realized that the first attack of sores isn't necessarily evidence of the first infection. Unfortunately, this frequently gets into a problem where 2 people are involved in a marital situation where one will suddenly show up with genital herpes, thereby raising the possibility of an extramarital sexual contact when in fact they may have had the genital herpes many years previously.
Okay, is there anything that a person could do, say, to avoid contracting the herpes, or is there anything a person can do to prevent it on to a sex partner if you're already infected?
Well, during the time that the sores are present, the person is highly infectious. Probably it's prudent to refrain from any kind of sexual activity for a week or so after the lesions have started to heal.
So the person is infectious when the sores are present, but usually not infectious when the sores have healed.
That's probably true, although the problem with women especially is that they may have very tiny sores inside the vagina that they're not aware of and therefore could be a carrier.
Would condoms prevent passing the disease?
Well, as you know, a condom may be useful in preventing passage of syphilis or gonorrhea, but we don't know whether that's the case for herpes. It probably has some protective value, but the problem is that this virus is very small. Obviously, also, a condom really can only protect the penis and would not prevent sores from appearing on the thighs or the lower part of the abdomen or elsewhere.
Mm-hmm.
We then asked Dr. Minkowski to talk to us first about gonorrhea in the male.
Yes. Gonorrhea is never a self-generating infection. It requires a sexual partner. Personal hygiene, body cleanliness has absolutely nothing to do with the transmission of this infection. The only essential for transmission of gonorrhea is the presence of the germ, the gonococcus, in one of the partners. Now, if the female is infected, then the germs of gonorrhea are present in her vagina. And during the sex act, her germs will pass from her vagina into the urethra of the male penis, setting up an infection there. And then in about 2 or 3 days, occasionally a little bit longer, the male is likely to become aware of a burning sensation in his penis when he urinates, and perhaps a day later, the presence of a discharge of a pussy material from his penis.
Do males always have symptoms as soon and as easily discovered as that?
No, not at all. In about 10% of males who are infected with gonorrhea, the symptoms are either totally absent or much less noticeable. Also, there are some discharges from the penis that are not due to gonorrhea. It's important to distinguish between those infections and the infection of gonorrhea, and the best way to do that is by way of the laboratory.
Let's talk to Dr. Addie Klotz, the Director of Student Health at the University of Southern California. Dr. Klotz, what about gonorrhea in women?
In women, the problem is far more serious. Here again, gonorrhea is never self-generated, nor is it a matter of personal cleanliness. In women, gonorrhea requires the sex act to transmit the gonococcus from the infected male into the mucous membranes of the female. In this case, from the urethra of the penis of the male into the vagina of the female. However, what makes the problem much more serious in women is the fact that whereas in males, most of them develop symptoms within 2 or 3 days of infection, 80% of women never develop any symptoms whatsoever, even after weeks or months or years, even though they've been infected with the gonococcus and actually have gonorrhea. However, if a woman is one of the fortunate 20% who does show symptoms, these symptoms would include painful urination, increased vaginal discharge, and pain, usually toward the end of the menstrual period and shortly thereafter.
What about the people you hear say this, Doctor?
Perhaps no worse than the common cold.
Well, that's pure nonsense. Unlike the common cold, gonorrhea will never go away by itself. Unless properly and quickly treated, the infected male will go on to infect others, who in turn will infect others, who in turn will infect others, and on and on. And he may develop scar tissue in the semen conducting tract, which will create sterility, thus making it impossible for him ever to become a father.
We thought you would like to know just how different are the effects of gonorrhea on women.
Gonorrhea in women may also start as an acute infection of the urethra, causing painful urination and discharge. However, it may spread in a variety of ways to involve other parts of the body. For example, it may spread directly up through the vagina, where it infects all of the glands and ducts around the vagina, into the uterus, and out into the fallopian tubes, where it causes severe inflammation. It may involve the ovaries and create a very painful condition known as pelvic inflammatory disease, if untreated, if not treated properly or adequately or quickly. Another way that gonorrhea may spread in the body is through the blood system, where eventually an infection of the lining of the heart may occur, or in knees and ankles and elbows and wrists and other joints, and very painful arthritis may occur. This will be very difficult to treat.
That sounded very serious to us. So we asked Dr. Klotz if there were any reliable tests to show whether a person has gonorrhea, and where one can go to get these tests.
Yes, there are reliable tests, available, of course, from your family doctor, most medical clinics, county health departments, and in some cities, the free clinic. If you're concerned about confidentiality, it's important for you to know that no matter what your age, your doctor will respect your wish to keep your treatment confidential. So will any clinic that you go to.
We wondered about people under 18 going to a clinic.
In an increasing number of states, laws are being passed stating that anyone at any age may appear for diagnosis and treatment of venereal disease, including gonorrhea, without parents being notified and without parental consent. That's the law.
This is one of the hundreds of nationwide public health clinics that treat venereal diseases. Dr. Shapiro, what reliable tests show whether a person has gonorrhea?
Well, if a male thinks he may have contacted the disease, we start first by taking a complete medical history. We're concerned primarily with what his symptoms are and how long he may have had them. Following that, we go into the examining room. It's a rather simple and painless procedure. We ask the male to drop his trousers and his shorts down, and then we do a complete examination primarily involving the male sex organs. During this, we try to obtain some of the fluid that may be dripping or discharging from the penis or the urethra, and then we can perform a complete laboratory examination on that. Okay, that's fine. All right, let's have you get dressed again.
We asked Dr. Shapiro how the tests for women differed from the tests for men.
Well, the test for the female is pretty much the same as it is for the male. We again start by taking a complete medical history, looking for the symptoms that the patient may have. From there, we have the patient go with our nurse into the examining room where the nurse helps her into a gown, helps her on the table.
I'll be with you in just a second. Don't worry now. It's going to be all right.
Susan, how are you doing?
Fine, thank you.
Okay, this isn't going to take long. We're not going to hurt you at all. The nurse will stay throughout the examination to help me to, again, examine the female sex organs and hopefully obtain some of the fluid that may be discharged so that we can bring it into the laboratory to do a thorough laboratory examination of the material. If we've been able to get a urine sample from the patient, we also examine that. That's fine. And you tell me if I hurt you at all, okay? That's not painful at all, is it?
No.
Fine. All right, now let's put her legs up in the stirrups. Now scoot on down towards me a little bit. That's fine. Now you tell me if I hurt you at all. That's not bad, is it?
No.
Now, you're a good patient. Okay, now I'm going to get some of that fluid for the microscope. Is this uncomfortable here?
That's okay.
The examination is really quite simple. It's of short duration and not at all embarrassing for the patient.
Uh-huh.
We'll help you get up. We're all done. That wasn't bad, was it?
No.
Good, you're a good patient.
At this point, we wanted to know about the cure for gonorrhea in both males and females.
Well, an important point that I think everybody should understand, that if they've contacted gonorrhea, or for that matter any of the venereal diseases, the sooner they can get started on a course of treatment, the easier it's going to be for them, the easier it's going to be for the doctor, and the more successful it will be. Also, if they can get started early, this may help prevent some of the complications, the future serious complications that might result from these diseases. It's important, though, for people to know that being treated and being cured of venereal disease does not prevent them from contacting the disease again in the future by the same or another contact.
We asked Dr. Shapiro how to prevent VD, how to keep from getting it.
Well, of course, the obvious answer to that would be for people not to have any sexual activity. Of course, this is unacceptable, and we know that's not going to work as a preventive measure. The next best thing would be for somebody to limit their sexual contacts. But this, of course, isn't a guard against getting the disease either, because one never knows who may have it. Even the so-called nice boys and girls may have venereal disease and, unfortunately, may not know it. The old idea that gonorrhea was found only among prostitutes and loose girls is really no longer true. Prostitutes only account for about 5% of venereal diseases. Well over 95% of the people who have venereal disease are not of this type of population. It occurs in any of the sexually active people in age groups from 14 on up, and the great majority of the people who have venereal disease are in the age group between 14 and 25.
Is there more VD now than years ago?
Oh yes, I think there's much more venereal disease than there used to be, and probably for some rather simple reasons. One may think that increased sexual permissiveness is part of it, but that's only a small part of the story. I think a large reason why there's so much more venereal disease is the use of the birth pill. It is the pill that's responsible for so many males no longer using the sheath or rubber condom over their penis during intercourse. The condom is much like this simple rubber device that we use in doing rectal and vaginal examinations. The control of venereal disease means a number of things. It means education, prevention, cure, and the follow-up procedures involving the use of people employed by the health department to find the source of the venereal disease and to get those people treated as well. Because not only is there a large percentage of people who don't even know that they have venereal disease, but there are even those cruel enough not to care if they infect their sexual partners.
This raises a very important point. The fact that one person with VD can infect others, who will infect others, who will infect others, etc., etc., so that one person may be responsible for hundreds, even thousands of other VD cases, unless this chain is broken, of course. The Department of Health in every state and city and at the federal level is very concerned with breaking this chain. Let's talk to Dr. Sidney Thompson of the Harbor General Hospital in Torrance, California. Dr. Thompson, what about syphilis? Especially this kind of statement.
I know someone who had VD and it went away all by itself.
That's a very unfortunate error. There are from 50 to 70,000 people with syphilis in the United States who do not know that they have it.
What about this comment?
I'm not worried. I can look at a chick and tell whether she's clean or not, if she has VD.
And what about this one?
If you don't see any signs or symptoms in your sex organs in a week, you don't have it.
And one more.
You can only get syph from a prostitute.
Let's take the last one first. Less than 5% of all venereal diseases are caused by prostitutes. And as far as looking at someone and knowing that she's clean, that's not very scientific or very bright. Not only do a lot of people show and feel no symptoms, but what's even more important, way of knowing or seeing what's happening inside their bodies or bloodstream.
What are the warning signs that we should look for?
First, don't waste time waiting for warning signs. If you believe you've been exposed to syphilis, get to a doctor as soon as you can, and in all cases, you will be tested. The first sign that you may be able to discover on your own usually occurs from 2 weeks to 3 months after exposure, usually in the form of a hard chancre or an open sore. In many cases, you may not notice it yourself because it is painless. While it may be visible on the male sexual organs, it is much less visible on the female organs. Now, when the chancre occurs on other parts of the body, it's still a painless sore and will go away by itself. By now, the germ, the spirochete, has spread throughout the bloodstream to the entire body. In a few weeks or a month, the secondary stage begins. A rash will appear as a sign that you have syphilis. Also, you may notice more sores appearing. After this secondary stage, which lasts from a few weeks to a few months, the victim enters the latent stage. Now the symptoms disappear altogether, and the victim is lulled into a false sense of security because at least 25% of them will be the victims of the spirochetes attacking the brain, causing insanity, the spinal cord, causing a form of paralysis, and the major blood vessels of the body, particularly the body's main artery, the aorta, and in many, the optic nerve causing blindness.
We asked the doctor what we thought was a very important question. For how long is a person with syphilis able to transmit it to someone else?
Syphilis can be transmitted while the sores and the rashes of the primary and secondary stages are present. During the latent or the hidden stage, which follows the secondary stage, the person with syphilis is no longer infectious during sexual contact. However, in the case of the female, the germ can be transmitted to the unborn child, resulting in severe deformities of the bones and the teeth and even death.
Let's see what the top federal agency has to say about the VD epidemic, its control and prevention. From Atlanta, Dr. Rafe Henderson, Chief of the Venereal Disease Branch of the Center for Disease Control for the United States.
Gail, I'd like to tell you about one aspect of the control effort that's critical to its success. It's called contact referral. We try to get diagnostic and treatment services to persons who may have been exposed to a venereal disease before they can pass that disease on to others. This is critically important to protect their own health, but it also helps us break those chains of transmission.
Your name, please?
Elaine Milburn.
And your address?
353.5.
Contact referral is a basic and routine part of the medical treatment of venereal disease. Doctors, or perhaps trained public health workers, talk to patients with venereal disease and ask for their help in getting information to their contacts who might have been exposed. The telling of that information to the contact can be done either by the patient or by the health worker. These workers are skilled in getting this information to the contacts without embarrassment. And as you know, Gail, it's the federal, state, and local policy that the name of the individual who gave the original information is never revealed by the worker. The worker's concern is simply to get all contacts treated just as soon as possible.
How do most people respond?
As you might expect, reluctantly at first, Gail. But when they understand that the choice is as simple as being able to help the others or to hurt them, they generally choose to help.
So much for control. But what is the most effective way to prevent VD?
There are 4 things that the individual can do to protect himself and those around him. The first is to minimize the risk of exposure. And medically, we know that that risk increases as the number of exposures to different sexual partners increases. Second, if one is to be exposed, one can try to prevent transmission. This can be done by the partners using a condom and using it so as to prevent all contact between the penis and the mucous membranes of the partner. The male can also urinate and wash with soap and water. Unfortunately, we know that doesn't work quite as well with the female. The third thing that can be done is that if the person thinks he's been exposed or worries that he or she might have symptoms of a venereal disease, they ought to get right away to a doctor or to a clinic to get the appropriate tests. Finally, the individual who is infected has got to get his contacts treated so that the chains of infection don't turn into circles that keep coming back to him or her again and again and again.
We have taken a chance. We're 12. Wouldn't be surprised or offended by what we've seen or heard. We hope you don't take the chance and overlook the facts we've presented without moral judgment. Facts about an epidemic disease. Facts that you should know. For your own sake, for the sake of the ones you love and love you.
3500 BC. In 1492, Columbus discovered the New World. In 1493, Europeans discovered that they had syphilis, probably brought back by Columbus's sailors. Soon trading vessels were spreading the disease throughout the world. By the 18th century, syphilis was so common, it was dictating fashion. Wigs hid loss of hair. Neck clothes hid throat sores. And makeup hid other telltale signs. Venereal disease and its damaging effects may have changed the course of history by infecting the bodies of such world figures as Henry VIII, Ivan the Terrible, and the Chancellor of the Third Reich, Adolf Hitler. Although venereal disease has dealt with dictators, it is really very democratic. It strikes Americans and Russians, rich and poor, young and old, male and female, the good and the bad. This year alone, over 500,000 teenagers will get VD. Except for the common, venereal disease is the most rampant communicable disease in the country. But exactly what is venereal disease? What does it do to you? And how do you catch it? A specialist, Dr. Stephen Sachs, explains.
In order to understand and really appreciate what we mean by venereal diseases, we must first take some time out to define the terms involved. First, the word venereal. Venereal is derived from the name of the Greek goddess of love, who was Venus. Secondly, what do we mean when we say disease? Well, disease in this sense actually is an infection. It's an infection not unlike the common cold or tuberculosis or measles or mumps for that matter. The only thing that's different from venereal disease is its mode of transmission. What do we mean when we say that venereal diseases may be transmitted through sexual acts? Well, in fact, sexual acts may include anything from kissing to sexual intercourse. Of course, sexual intercourse is the most prominent mode of expression that affects the urinary tract. That is the urethra, the tube through which a male urinates. In the female, on the other hand, gonorrhea affects the reproductive tract, not the urinary tract. Gonorrhea may also affect the joints of the body in both the male and the female, causing a rather severe arthritis. The infection of syphilis, unlike gonorrhea, is not limited to the urinary tract in the male and the reproductive tract in the female. In fact, the infection of syphilis may occur anywhere on the body, although of course most commonly it occurs on the genital area, the penis, and the vagina. However, once infection occurs, the infection then spreads to all the organs of the body. And this means it spreads to the heart, the lungs, the kidneys, bones, liver, and of course the central nervous system, including the brain and spinal cord.
Well, if you know so much about VD, I mean, why can't you do something about preventing it?
Yeah, like polio. It was an epidemic, and they came up with a vaccine so we can't get it.
Unlike polio, the germs that cause VD are very sensitive to light and air, so they're difficult to isolate and study. But don't let that fool you. We know that venereal disease can be effectively and painlessly treated in the early stages. And second, we know the signs that might indicate you have VD.
Here it is. G-O-N-O-R-R-H-E-A.
What are you going to do if you have it?
I got it.
Oh, no.
Not the disease, the word.
Oh.
Now, let's see. Look. It says here that a girl with gonorrhea may not notice any symptoms at all.
But look here, it also says that you may feel severe stomach pains around the menstrual cycle. Well, maybe you don't feel well just because you're upset and scared.
You better believe it.
For males, the symptoms of gonorrhea are, of course, different.
Hey, man, bring me the wrench. Hey, Jimmy, man, where's your head at? Give me the wrench.
Come on, man, get these things out of the way.
Come on now, man, we ain't got all week. Oh, man, I can't pull the plug. Hey, man, look, I don't feel like messing around with this thing.
It's fine with me, man. They're your wheels.
Hey, man, look, I know, but I got problems. I think I got the clap.
You finally got it, huh? I knew it. No one can get around as much as you do and get off free.
No, but serious. I don't know whether or not I have it. Does either of you guys know for sure? I had it once. Yeah, well, listen, this is funny, but don't laugh. When I go to the bathroom, I get this burning and this stinging pain. Man, that really hurt. What do you think?
Man, you got it. I mean...
I think he's right. Sounds like...
That's right. You should. It's too important. The mental strain of worrying whether you have VD is not worth it. It's just too simple to cure it. At this stage, it may involve only taking some pills or getting a few injections. Now, let's review the warning signs of gonorrhea. In the male, inflammation of the genitals, a burning or stinging sensation when urinating, and a yellowish discharge from the penis. These symptoms should develop within 10 days after contact with the disease. In the female, the symptoms are less obvious. There may be severe stomach pains around the menstrual period, but keep in mind there may be no outward signs at all. If the venereal disease contacted is syphilis, a sore will develop where the germs entered the body. This will happen to both the male and female within 90 days after contact. The sore is painless and will go away without treatment, but don't let that fool you. It doesn't mean you've gotten rid of it. It only means it's gone underground. Early treatment is the key to curing both these forms of venereal disease. Help can be found at various places. Hospitals, public health centers, free clinics, and private physicians. One of the most important aspects of halting the spread of the disease is to reach all of those who have become infected. You should name those you have had intimate sexual contact with. It's often hard to talk about a sexual experience. But if you care about others, you should see that they get help too.
Well, there were two boys. One was just, well, you know, just a mistake. But the other boy I really care about. I'd never want Rick to know about him. Can you promise?
Sure. VD records by law are private. Both boys will be notified that they may have come in contact with VD. We won't say who that contact may have been or how we found out. Your name will never be mentioned.
Well, what about my folks? Will they have to find out?
No, in fact, over half the states permit doctors to treat minors with VD without parental consent.
Then this guy from the public health department told me that he wouldn't tell my parents, but that I should come in for a checkup, like really soon. Then he really came down on me. He wanted to know who I've been fooling around with lately.
Well, what did you tell him?
Well, he said it was for their own good, so I told him about it. I wonder which one I got it from.
Obviously, the more sexual contacts a person has, the more likely he or she is to come in contact with VD. Now, we've all heard stories about VD causing insanity, blindness, heart failure, sterility, and even death. Are these stories true or false? Dr. Sachs gives us the answers.
In order to understand and appreciate the effects of untreated gonorrhea and syphilis, it is really best to remember which parts of the body are affected with these infections. When gonorrhea infects the male urethra, the tube through which the man urinates, it becomes severely inflamed and excruciatingly painful. Now, the result of this inflammation is scarring, and these scars cause narrowing of the urethra and eventual inability to urinate. This inability to urinate, in fact, will cause back pressure on the whole urinary tract, including the bladder and kidneys, with resultant damage of both organs. The female reproductive tract, which is infected with gonorrhea, is also damaged by severe inflammation and scarring. The severe inflammation caused by gonorrhea causes a syndrome much like acute appendicitis about the time of the period. The end result of the acute inflammation and scarring is a very high incidence of abnormal pregnancies, miscarriages, and even sterility. Untreated syphilis, as you will remember, affects all the organs of the body. The resultant damages will include destruction of the heart valves and eventually heart failure, and if the infection affects the central nervous system, the results are paralysis, blindness, insanity, intractable pain, and even death.
It's pretty frightening, huh? Unfortunately, VD has never been considered a topic of open conversation, and because of this, many myths have flourished about it.
VD. A friend of one of my clients had it. I understand he tried to get rid of it, but never could.
Not so. In the early stages, venereal disease can be easily and painlessly cured.
That's certainly not my problem. I never frequent public restrooms.
Sorry, it can be your problem. Disease from toilet seats, or for that matter, any object. You get it.
That's all for me. Now I'll never get it again.
Wrong. No immunity is built up to VD, no matter how many times you've had it. You can get it every time you come in contact with it.
VD? It's not my problem. I take birth control pills. I'm really safe.
Don't count on it. Birth control pills may prevent pregnancy, but they have no effect on venereal disease.
Man, I know guys who had it, but it just goes away.
Dead wrong. It never just goes away. So that's VD, venereal disease. An infection, like any other infection.
It's a health detected by the school nurse during a school took only 30 seconds, and her scoliosis was detected early. With a bill to do, kids can do. This Tracy, she has scoliosis too. Since Tracy still had no screening program, her back curve wasn't detected early enough. Bracing could not correct her curve. As a result, she has had to have back surgery. But she's okay now and can do lots of things even in her body cast. Had Tracy's scoliosis been detected earlier, she could be doing all the things Jenny can do. A simple 30-second examination done at the proper time by the school nurse or physical education teacher could have prevented the need for Tracy's back surgery and enabled her to get by with a brace alone, even though it might have meant wearing the brace for a year or two. The normal spine of a standing person is perfectly straight when viewed from the back. In most cases of scoliosis, the spine, for unknown reasons, does not grow straight. But just what is scoliosis? Scoliosis is a side-to-side curvature of the spine. If a child attempts to stand straight, and yet some bending is seen to one side or the other, scoliosis is present. The X-rays of the normal back show a balanced skeleton. The vertebrae appear to be piled up on one another like a pile of bricks. To show the effects of scoliosis, we have represented the spine with a rubber tube seen from the back. To make the tube better represent the human spine, it has been split lengthwise and the center line marked. When the tube is bent to resemble a scoliotic curve, you can see that the bending has caused a rotation of the center line. The same thing happens when the spine deforms as in scoliosis. If we add the ribs, the skeletal model is complete. With the ribs present, we see that due to the bending and rotation, the ribs on one side collapse toward each other, and the ribs on the other side separate and expand. In advanced cases, the pressure of the rib cage on the heart and lungs can lead to breathing problems, lung collapse, and even premature death, especially in middle age. In the most severe cases, impairment of the spinal nerves can occur. Here we have flexed the tube to represent a 58-degree curve. When we view an X-ray of a 58-degree scoliotic back, we can see that the model does represent the real-life situation. When we return to observe the back of the patient, the curve, though visible, does not suggest the serious nature of the spinal and rib cage deformity hidden under the skin. Is such a slight-appearing curve cause for alarm? The answer is yes. The reason: a child at age 9 with a slight curvature has much growing to do. A slight curve now, untreated, could mean a severe curve in a few years. Scoliosis doesn't go away by itself, even with exercise. Active treatment is always necessary for progressive curves. Why all the fuss about a back with a few curves in it? Because the problem of scoliosis is not a small one for the person who has it. If left untreated in the early years, the disfigurement will become more noticeable and pronounced. As the years progress, the deformity can become so great that even with surgery, a permanent and visible curve will be left. Whole families are involved sometimes with the characteristic curve being passed on from mother to children. Although the disfiguring appearance can be at least partially covered by clothing, psychological and social sensitivity remain. Feelings of inferiority and embarrassment are common. Since scoliosis affects primarily girls, such cosmetic defects produce extreme sensitivity on the part of the patient. With age come aches and pains, often sufficiently severe to impair normal employment and earning capacity, as well as creating excessive irritability and disruption of normal family life and happiness. In its most serious form, the scoliotic patient may find that he's unable to continue any normal activity. Because of abnormal back mechanics, arthritic symptoms and pain result. Total dependence on oxygen and other life-supporting systems may become essential. Not a small matter for the one who must endure these symptoms daily, and for life. But does this mean that such children, as these sisters, ages 13 and 17, with significant curvatures, are predestined to a life of agony? Hardly so. You may be required to wear a brace before surgery and must wear a cast after surgery, followed by additional bracing. All this to prevent the complications which we have discussed. But how much easier and less expensive it would have been if the scoliosis had been detected early and a brace alone could have solved the problem. With bracing, the child can continue essentially a normal life, going to school, participating in most athletics and social events, without the risks or complications of a major surgical procedure. But how can all this come to be? How can we be sure that all children will be spared the unnecessary progression and continuously worsening affliction of scoliosis? Actually, the process is simple. The type of scoliosis with which we are most concerned is first observed in the 10 to 13 age group. During this period, most children experience a rapid growth spurt, which is usually completed by age 16. This may vary depending on race and ethnic origin. Because of the rapid growth spurt, this is the age range when early detection is most effective. Bracing alone will work only when there is still growth of the spine. Once growth has stopped, surgery is the only recourse for a pronounced curve. Scoliosis primarily affects girls, often with more than one family member being involved. Boys can also be afflicted with the deformity. Therefore, all children between the ages of 10 and 13 must be screened, and the most reasonable place to do so would appear to be the school. This screening could readily be accomplished by school nurses or physical education teachers. Since routine screening for vision and hearing is already an established part of school preventative medicine, there's no reason that an additional 30 seconds could not be added to prevent a lifetime of suffering. When we consider that 8 to 11% of all school children in this age group, 10 children in 100 show some evidence of curvature of the spine, there is no legitimate reason for not implementing such an early detection system. Let's return to the rubber model. Remember, the curve is accompanied by rotation of the spine and rib cage. If the model is tipped over so that we can look down the spine, we see that because of the rotation, the rib cage is high on one side of the back. This characteristic of the rib cage provides for a simple and sure test for even slight spine curves. How does one go about such testing of a child? Very simply. First of all, the examiner should look at the bare back. Girls may wear a bra without detracting from the value of the examination. Look for the level of the shoulders. They should be even. If one shoulder is higher than the other, be suspicious. Are the hips level? If not, further question arises. Does one shoulder blade appear to be more prominent than the other? If so, scoliosis is probably present. Even if none of these signs appear, the most important test is to have the child bend toward the examiner as she looks straight down the child's back. The child is asked to bend at a 90-degree angle at the hips while both arms drop straight down from the shoulders, and at the same time holding the fingertips of the extended hands together. Holding the hands in this manner prevents twisting of the back, which would give a false impression of a curvature. The two sides of the back should be absolutely symmetrical. If one side is higher, a curvature of the spine is present. This child does not have scoliosis. The test is simple. Remember to look for uneven shoulders and hips and a prominent shoulder blade. Then have the child bend over, arms hanging down, fingertips touching. Look carefully first at the upper back and then the lower back. If scoliosis is present, a hump will appear on one side of the upper back, and a compensating hump will usually be seen on the opposite side of the lower back. This child has scoliosis. Though not recommended, screening may be done with clothes on. A tight-fitting, plain garment with no stripes or pattern is best. The evaluation of hip evenness and protruding shoulder blades is much more difficult. The uneven hump of the back, however, is still recognized even in this example of a slight curve. This is why the bending test is the most important test. As you have seen here, the scoliotic curves shown are very slight, but typical of what you will find during screening. Many of these, 8 out of 10, are fortunately not progressive and will not require treatment. What if a definite case or even a suspicion of scoliosis should be found on testing? Then the parents would be notified and the child referred to the family physician, pediatrician, or orthopedic surgeon for an x-ray of the spine in the standing position. If a curvature of the spine is confirmed, the child will be referred to an orthopedic surgeon who handles such problems, or to a scoliosis treatment center. At that office or clinic, the x-rays will be reviewed by one or more doctors, and the patient will be thoroughly examined. The doctor may wish to first check the patient with her clothing on. He will look for alterations in shoulder and hip height, plus any humps or prominences. He checks the back for sway back. The patient will be required to bend forward, and in this girl, both an upper and lower curve can be seen. Next, the patient will be asked to put on an examination gown for even greater visibility of the back. The doctor will trace out the curves of the back, and in this case, a double curvature is seen. An increased flank fold is also observed on the right, which shows that this child's scoliosis is significant. The patient is then asked to bend forward to double-check the prominences. First, the upper hump is clearly seen. As bending continues, the lower is also apparent. Each hump and crevice is carefully observed with and without motion, from both a distance and at close range. The patient may go through many bending motions as the exam progresses. Comparing the patient with the X-ray, the upper or dorsal curve is outlined, followed by the lower curve and the flank crease. These same abnormalities are then pointed out on the patient's X-ray. 2% of all children tested will need active treatment, ranging from bracing to surgery. But with early detection, the incidence of surgery is significantly reduced. The screening for scoliosis has been so successful in the state of Delaware that virtually no school children in that state have required surgical correction for the type of scoliosis for which we are testing. Bracing alone has properly handled all those cases detected early, even if the brace had to be worn until growth was complete. So screening for scoliosis makes sense, particularly if you are the parent or child who has a curvature of the spine and are unaware of the deformity. Since scoliosis will frequently run in families, if one case is detected, other family members should also be checked, even if they're older or younger. Further, the nurse may detect other back deformities that are often considered to be a family trait and as such ignored by the parents and relatives. Scoliosis is a side-to-side curvature of the spine. If progressive curves are left untreated, they will become continuously more severe. Because of the nature of the spine and ribs, the curve is accompanied by a rotation of the spine, resulting in uneven humps on the back. The deformity leads to fatigue and eventually pain, with significant physical and psychological complications. If detected early, through school or community screening each year, between the ages of 10 and 13, the probability is great that the 2 children in 10 so afflicted can be properly treated by bracing alone until growth is completed. Bracing will only slightly diminish the activity level of the growing child. The long-term result will be the successful return to normal of a person who might otherwise have been crippled for life or subjected to major surgery. Scoliosis will not go away by itself. Active treatment is absolutely necessary. The physical, mental, financial, and social afflictions associated with scoliosis are difficult enough for those who must endure them. But wouldn't it seem more reasonable to prevent such suffering, especially when it can be done by a simple 30-second test? A 30-second investment for a lifetime of dividends.
There are 3 important things we must have to live. They are food. We can't go for many days without eating. Pure water. We need it even more often than we need food. Then, clean air. We would die if we couldn't breathe. In many towns, there is a smog problem. Many people must breathe this dirty air, and it can damage human lungs. Yet, many people who complain about air pollution, that is, dirty air, purposely inhale dirty air into their lungs as they smoke. The dirty air from inhaled cigarette smoke is filled with tar and chemicals. Since we can't open a living person to show just how dirty cigarette smoke is, we will use a model. These jars filled with white filter material are the model's lungs. This filter will collect the dirt from the cigarette smoke. The amount of tar and dirt that the average smoker inhales in 1 month of smoking makes the model's lungs look like this. Quite a difference. Human lungs are very delicate. The breathing tubes are lined with small hairs called cilia. These hairs are covered by a sticky substance called mucus. Normally, any dirt that enters the body is carried up and out by the cilia and the mucus. This is how the body protects itself against inhaled dirt. A person who smokes inhales all kinds of dirt. Only a part of this is breathed out again. Cigarette smoke causes this important dirt removal system to stop working. Mucus and the dirt from cigarette smoke plugs up the small air sacs in the lungs called alveoli. Infection starts, and when the smoker coughs, the air sacs burst. And if much of this happens, the person becomes permanently breathless and then very ill. A healthy lung looks like this. But much of the tissue in this lung has been permanently destroyed by smoking. Notice the large holes. People with lung damage like this have a disease called emphysema. This emphysema victim must carry his own supply of oxygen with him all the time. It is so hard for him to get air in and out of his lungs properly that it is almost impossible for him just to blow out a match.
I have emphysema. The doctors tell me I got it from smoking cigarettes. You can't imagine how important it is to be able to breathe until you have trouble just going upstairs. I not only have trouble going upstairs, I couldn't possibly ride a bicycle.
Inhaling cigarette smoke can also cause another serious disease of the lungs, cancer. Cancer is a disease which destroys body tissues.
Oh, yes. Yes, we can tell if this man was a smoker just by looking at his lungs. You know, 50 years ago, there was almost no lung cancer in the United States, but now, with so many more people smoking, we have a lot more lung cancer. I'm so glad to see that some people are really starting to realize that smoking is dangerous.
Another cancer is caused by cigarette smoke passing through the breathing system. In this instance, the larynx, or voice box, is affected. This is the organ that makes it possible for people to speak. Often, when cancer affects the larynx, it must be removed. A permanent breathing hole must be made. All breathing must be done through this hole. This operation is called a laryngectomy.
The doctor told me my cancer was caused by smoking. I speak by trapping air and forcing it out of my throat. But this woman has not yet learned to speak. She has been working at it for over a year. There are thousands of people just like us because my breathing hole leads right into my lungs. I have to be very careful taking a shower, and I cannot go swimming. Water would get into my lungs, and I would drown. That's what cigarettes did to me.
Cigarette smoke can also damage the heart. Heart disease is the leading cause of death in America. Cigarette smoke can affect the heart, starting with the very first puff. This is the heart rate of a person before smoking a cigarette. After lighting a cigarette, look, the heart immediately begins to beat faster. It has to work harder. Let's look at that again. The effects of smoking do not wait until you are older. They begin to appear as soon as you light up the first time. Not everyone who smokes will have lung cancer. But we do know that for everyone, smoking affects the dirt removal system of the lungs. And that for everyone, the heart must work harder with the very first puff. And once a person starts to smoke, the habit is very hard to stop.
Smoking? I don't need cigarettes. I don't need them. I don't like them. They taste bad. What can I say?
I think that cigarettes make your teeth dirty and yellow, and your breath smelly, and your fingers smelly, and that doesn't make you glamorous at all.
I like to surf a lot, and in physical activities, like they meant more than smoking.
There are other reasons to ask yourself, why should I smoke? For instance, there are a lot of other things you can buy with the money. When there are so many reasons not to, why do some young people still smoke? Why?
Well, I guess I started because it made me look glamorous, you know.
Well, I smoke because, well, when I first started, it was just kind of like the big thing to do, you know. It was, right now it's just kind of a nervous habit.
Well, I thought at first it would make me look sophisticated and older and, you know, up with the crowd.
And it gave me something to do and, you know, made me look like a big man.
I figured if it was all right for one of my teachers to smoke, then, you know, why shouldn't I do it?
Not everyone who smokes will die or be sick, but some people will. And now that you know some of the facts, will you smoke?
From one point of view, there are two machines in this picture. For people require fuel to produce energy, just as machines do. But no machine is nearly as fantastic as the human body. The body acquires its energy from a very complex combination of fuels, which are taken from many sources. With our machines, we're very careful to put in only exactly the right fuel. But what about ourselves? Not satisfied with what we need, we fill up with practically anything, whether it's good for us or not. Alcohol is one of the non-fuel extras people take, one that can cause a lot of trouble if we take too much. How much is too much? Perhaps on a warm afternoon, you've noticed someone getting sleepy after drinking a few beers. The alcohol in beer is a drug which affects the functioning of the body. There are drugs, chemicals, which affect us in many substances which we take into our bodies. Most of these are not healthy, but usually the chemical is contained in such a very small amount that there is no immediate dangerous effect on our health. The alcohol in beverages is a type called ethyl alcohol. Like other drugs, it is often used in medicines, such as in cough syrup. But completely apart from its use in medicine, people drink alcohol because they enjoy it. People have been drinking it for thousands of years. But when misused, any substance can be harmful. Alcohol is not just any substance. It is a very powerful drug. And sometimes some people drink too much. How much is too much? As a first step to an answer, let's see how alcohol affects a fish. If we add alcohol to the water, as the fish breathes, the alcohol will enter his bloodstream. We will not give him enough to kill him, but he will probably have a very bad headache when he recovers. Relative to its size, we are giving the fish about the same amount of alcohol which would intoxicate a 150-pound man. The overall effect of alcohol is described as intoxication, or in more everyday terms, drunkenness. Whatever we call it, it's pretty obvious that friend fish has had too much. How much is too much? Let's look at what happens when alcohol is taken into the human body. On reaching the stomach, alcohol is not digested. It passes through the walls of the stomach and small intestine, into the bloodstream, and then to the brain. When a man weighing 150 pounds takes one drink containing 1/2 ounce of alcohol, the alcohol reaching his brain begins to affect his ability to make decisions. With 3 drinks, reaction time and coordination are impaired. After 5 drinks, vision, speech, and balance are affected. With 8 drinks, he has trouble with walking and standing. If our 150-pound man goes as high as 20 drinks of 1/2 ounce alcohol each, he will lose consciousness. And if he could consume 25 before he passes out, he might die. Continued heavy use of alcohol destroys tissues in the brain, the kidneys, and the liver. Some people develop a disease called alcoholism. They develop a dependency on alcohol and seek to be frequently or continually intoxicated. The continuing need for alcohol not only slowly destroys their health, but creates terrible problems with family and work. Some alcoholics leave life behind and think of nothing but the next drink. But the long-term effects of heavy drinking are not the only dangers of alcohol. Each and every time a person drinks, he must respect the powerful nature of alcohol. A little too much, and the effect of alcohol can cause him to be a problem and a nuisance to others. At worst, a little too much at the wrong time, and the effects of alcohol can lead to tragedy. The misuse of alcohol may be caused by a number of personal, emotional, and social problems. But alcohol is not often misused by a person who is mature enough to respect himself and others, and who has enough information to give him healthy respect for the power of alcohol. The decision to drink or not to drink is a decision which each individual must make for himself. When a person decides to join those who drink alcoholic beverages, there are other facts about alcohol which it is very important to know. Alcohol has different effects on different people at different times. Alcohol taken on an empty stomach will affect the drinker more quickly because it can be absorbed more readily by the stomach and intestine walls. Generally, a large person will show less effect from the same amount of liquor than a smaller one, simply because he has more blood in which the alcohol is diluted. The period of time over which alcohol is consumed varies the effect on the drinker. 3 drinks in 1/2 hour will make one much more intoxicated than 3 drinks in 2 hours. But whatever the variables may be, even a small amount of alcohol has an effect on the drinker, and he must exercise his judgment as to where and when he drinks. And most important, to know how much is too much. But because of the effects of alcohol, people find themselves with a lessened ability to judge and make decisions at a time when they need that ability most. This situation is probably most dangerous to the new drinker, for he has had little or no experience in dealing with the effects of alcohol. Because a person feels relaxed and his inhibitions have been lowered, it's easy for him to feel overconfident when he should be more cautious. Many drinkers, especially new drinkers, who are ordinarily mature and responsible people, find themselves misusing alcohol before they realize how much is too much. Someday, you must make the decision whether you will be one of the millions of people who do not drink or one of the even more millions who do. A shot of whiskey, a cocktail, a glass of wine, a glass of beer. Each of these contain about the same amount of ethyl alcohol, about 1/2 ounces of a powerful drug that changes the way the body functions. The human body, just as a machine, will not function well with too much of the wrong kind of fuel. Alcohol is dangerous when misused. It must be used with respect and maturity. When the time comes, if you decide that you shall be one who drinks, that's not the really big decision that requires maturity. With alcohol, all the little decisions are really big ones. For if a person has respect for himself and others, every time he drinks, he must be aware that the drink in his hand contains a drug. And every time he drinks, he must make the decision, how much is too much?
There are 2 common dental diseases that may cause you to lose your teeth. Both diseases are caused by bacteria. Tooth decay, or dental caries, is caused by bacteria living on the surfaces of the teeth not covered by the gums. The other disease, or periodontal disease, is caused by bacteria living around the edges of the gums and in the spaces between the gums and teeth. Tooth decay and pyorrhea can be controlled or prevented only if these bacteria are removed every day from the sheltered areas. If the bacteria are examined under a microscope, many different forms can be seen, some moving around rapidly. Since these bacteria cause dental disease, it is very important that you know how to properly remove all of the germs. Although a brush cannot clean all the surfaces of the teeth, it is still an important aid to good dental hygiene when used properly. This brush may have even bristles that will not damage the delicate gum tissue, but when used properly, will remove bacteria from between the teeth and gums. Place the brush at an angle of approximately 45 degrees toward the gums so that some of the bristles will work in between the gums and teeth. Vibrate the brush gently to remove the bacteria. Clean around all the edges of the gums. An area that is often neglected when brushing is the tongue side of the teeth. Remember to place the bristles toward the gums and clean thoroughly. Is the back of the front teeth. You may find it easier to brush from the side. The chewing surfaces are cleaned by scrubbing with a back and forth motion. First, place the bristles where you want to clean and vibrate them between the teeth and under the gums. You should establish a definite pattern, such as brushing all of the upper teeth before brushing the lowers. When you brush, take plenty of time and clean all surfaces well. Make sure your teeth are clean. For added protection against tooth decay, regular use of a fluoride dentifrice, recognized by the American Dental Association, is advised. The brush will not reach in between the teeth. It is in these places where most cavities and pyorrhea start. If the brush only is used, almost 1/2 of the surfaces of your teeth will remain covered with bacteria. So in order to clean between the teeth, you should use dental floss. Use plenty of floss, about 18 inches. To hold the floss, wrap it around your fingers until the thumbs and fingers are about 1 inch apart. Leave your index fingers and thumbs free. The thumbs or index fingers are then used to place the floss between the teeth. Move the floss back and forth gently to insert it between the teeth. With the floss held firmly against the tooth surface, curve the floss around the tooth. Place it below the gum. Use an up and down movement 2 or 3 times until you hear a squeaking noise. This noise will indicate that the tooth is clean. This is a special floss without wax, so that its many filaments may spread out and entangle the bacteria. It is thin so that it will go between the teeth and under the gums. Be sure to clean both sides of each tooth. People tend to be more thorough if they learn to floss without a mirror. Sit in a comfortable chair and use the floss while reading, relaxing, or watching television. Simply wrap the floss around your fingers so that it does not slip. With your thumbs close together, place the floss between the teeth. Curve it around the tooth and bring the floss up to a position below the gum line. If it hurts, you're forcing it too far under the gums. Some bleeding does not necessarily mean injury, but rather that the gums are diseased. Remember that healthy gums do not bleed. Cleaning the teeth with floss may seem awkward at first, but it becomes easier with practice. The important thing is that the teeth are clean. You should establish a definite pattern. For example, floss all the upper teeth before starting on the lowers. This tablet contains a harmless food coloring that stains the bacteria. After you floss and brush your teeth, take one of the red tablets, chew it, and let it dissolve in your saliva. Swish the saliva over your teeth. You may swallow it if you wish. Examine your teeth in a mirror to see if you have missed any bacteria. By observing the stain, you will learn where the hard-to-clean places are. Re-clean those areas that were missed. Remember to use light pressure on the brush, since it is the ends of the bristles that do the cleaning. In a short while, you will find that you are cleaning well. Floss and brush your teeth thoroughly, at least once each day. Make and keep regular appointments for a check on your progress. If you have been cleaning your teeth properly, you will find at future dental appointments that you have dental disease well under control. Remember that pyorrhea will not begin around a clean tooth, and that a clean tooth will not decay.
For the first 6 months, a baby lives, learns, and loves almost entirely through its mouth. For the next 70 years or so, the mouth will be its main organ for communication, and everything the body needs for growth will be taken in through it. Many aspects of the mouth are among the most interesting in the human body, and its development from baby to adult one of the most complex, as X-rays reveal. At birth, hidden by the gums, the temporary or milk teeth are already partly formed. Even at this early age, the minute buds of the first permanent teeth are developing deep within the jaws. During the next 2 years, the temporary front teeth erupt through the gums. Even as the temporary teeth are growing, behind them the permanent front teeth develop. Around the age of 6, the first permanent molars break through. By 7, the jaws seem full of teeth. Some of the temporary teeth are being lost, and the permanent teeth pushing through to replace them. By about 10, there's room for the final permanent molars to form, often called the wisdom teeth. 20 years of growth and a fully developed mouth. Jaws and teeth are arranged for life. As the jaws and teeth grow, so do the soft tissues. The gums are the surface skin, a constantly renewing surface protecting the junction between teeth and bone. Then the tongue, 2/3 in the mouth, 1/3 in the pharynx. Almost all muscle. Of the many muscles in this area, the largest are for chewing. They move the jaw. Surfacing the whole area is a profusion of nerves, motor, sensory, and autonomic, interwoven with a network of blood vessels, from arteries to the finest capillaries. So near the surface is the capillary network, it's plainly visible through the mucous membrane. and gives the mouth its pink-red color. The soft palate and uvula, all part of a complex and perfectly evolved system. The mandible, or lower jaw, has sideways and rotary actions, as well as a powerful closing action. Movement made possible by a form of hinge and sliding joint between mandible and skull. The front teeth are sharp to cut and tear. The lips form a seal to retain both food and drink. Biting is voluntary. Chewing involves many reflex and unconscious actions. The tongue maneuvers food between the molar teeth, where it's crushed into small pieces ready for swallowing. To swallow, the tongue rises to the roof of the mouth and forces the food into the throat. At normal speed, the whole process of mastication and swallowing is extremely quick. The mouth includes many safety devices. Just as a baby uses its mouth to test objects, so does an adult. The tongue, the mucous membrane, and the lips are among the most sensitive areas of the body. Between the ice and the coffee, there is a difference of 70 degrees centigrade, extremes which other skin surfaces find hard to tolerate. The lips can sense temperatures accurately and tell us when they're acceptable. With food, too, the mouth protects the body, distinguishing the acceptable from the unwanted. It's extremely sensitive to shape, size, and texture of objects, and rejects them when unsuitable. Test this with a metal pellet. Of course, teeth can be broken on things like this, but it doesn't happen often. The moment the teeth detect the ball, the jaws stop closing. Where the tooth surfaces bit the metal, the forces may be extremely high, yet the teeth didn't break, and the chewing stopped. Why? The answer is not to be found at the top of the tooth. The enamel, almost entirely mineral, has no feeling. Though only 1 or 2 millimeters thick, it's nearly as hard as diamond. Beneath the protective enamel is the more sensitive dentin. And beneath that, the dental pulp, containing blood capillaries and nerve endings. But it's the periodontal membrane linking tooth and jaw bone, which is the major safety device. During chewing, the fibers act as multiple shock absorbers. It is the nerves here which transmit the main warning of excessive pressure. All in all, a complex and highly efficient safety system. Teeth are tough. The hardness of enamel gives great durability. His teeth formed 1,000 years ago, yet they've not decomposed. But enamel has one weakness. It can be attacked by acid. It will dissolve in a concentration no greater than plain lemon juice. Once the surface of the enamel has been dissolved away, the network of its structure is exposed and unprotected. But in the mouth, the dissolving action of acids, like lemon juice, is slowed down because of the protection given by saliva. It washes and cleans and is also slightly alkaline. Glands at the back of the jaw and below the tongue secrete this sticky liquid, which moistens the whole area. Each day, about 3/4 of a liter of saliva pours into the mouth, ending up as around 600 separate swallows. Only during sleep does saliva flow nearly stop. Hard particles which might harm the body are wrapped in saliva, which also lubricates the mouth and pharynx. The constant flow helps wash away food debris. Many factors increase the rate of saliva flow. Merely looking at food can stimulate the flow, or smelling it, or even talking about it. Saliva is also necessary for another function of the mouth. Only when foods are in solution can they be tasted. A dry lump of sugar is tasteless until saliva starts to dissolve it. Taste is detected by thousands of minute taste buds. Those at the back of the tongue are grouped in clusters below the surface. Saliva, with food in solution, reaches them through narrow channels. There are only 4 basic tastes: sour, a reaction to acids; sweet; bitter; and salt. But the way in which we identify so many different flavors is largely by our sense of smell. Tastes and smells are often confused. But the sense of smell is much more discriminating. Aromas are detected at the back of the nose, and what you think you're tasting, you may, in fact, be partly smelling. Without sight and smell, onion could be confused with apple. Taste, when combined with smell, is another device to guard the body. Yet the mouth is a main point of entry for microorganisms, possibly millions every day. There may be bacteria, and their presence is natural. Though sometimes harmful, in a healthy mouth they normally exist in a state of balance. Because we eat soft, sticky foods rather than raw and tough foods, a minute layer of saliva and food debris forms around and in between the teeth. It becomes bound to the tooth surface. When left undisturbed, bacteria grow, and after a few hours, a layer called plaque forms. Magnifying 17,000 times, we can see the bacteria within the plaque. At first, they're relatively harmless, but soon the layer thickens and the bacteria flourish, using sucrose from sweet foods to coat themselves in a form of glue. Unless cleaned away, the bacteria will convert this sugar into lactic acid. This weakens the tooth enamel, which dissolves, opening the rest of the tooth to attack. Beneath the damaged surface, the decay has already penetrated much further. The unique development of the human mouth is speech. It draws on the whole mouth's sensitivity and dexterity. Palate, tongue, teeth, and lips all work in precise coordination to mold and shape the simple sounds produced by the larynx into intelligible speech in infinite variety.
Mag ik u heel erg bedanken.
Ndiza kuthetha isiXhosa.
Thank you very much.
This, then, is our mouth, the channel connecting our body with the outside world. With it, we select the materials we need. Served by a delicate system of nerves, blood vessels, and muscles, the growth of the mouth is one of the most complicated developments in the human body. From first to last, it's the medium through which we express our ideas and communicate our needs.
Someday, other hands may offer you drugs. You must decide. Everyone must decide. Drugs, use or abuse. Susan's father leads. Susan's father has a medical problem, diabetes. To stay alive and healthy, every day he must take a drug prescribed by his doctor. What are drugs? How do they help us with medical problems? Any chemical which affects the way the body functions is a drug. In medical use, drugs can help our bodies to function in a normal way. Some drugs can fight disease. Some can promote healing. Drugs, chemicals which affect our bodies, are also part of the everyday world. Tea and Coke all contain substances which have an effect on the body. Drinking too many martinis at one time can produce alcohol poisoning, which could kill the drinker. Cigarettes contain nicotine, which shrinks our blood vessels and makes our heart work harder. We keep dozens of ordinary household items out of the reach of small children because they contain chemicals, drugs which could severely affect and damage the body. Some are very strong. Mild drugs for medical purposes are kept out on the shelves at the drugstore where anyone can buy them. But even mild drugs must be used properly. Strong drugs are made available only at the direction of medical experts. Doctors, more than any other people, understand the working of the human body. They study and continue to study how the body reacts to different drugs. Stimulant is the term for any drug which speeds up a body function. Depressants work in just the opposite way as stimulants. Depressants slow down a body function. This patient is given a type of depressant drug to relieve the pain of a major operation. There is a special reason for great care in the use of many depressant drugs. If some depressants are given for too long a time, the body comes to depend on them. Drug dependence brings sickness and great pain when the drug is taken away.
Skill and knowledge are required with the use of all drugs. The right drug, in the right amount, helps with medical problems. The wrong drug, the wrong amount, can cause great harm. Not every medical problem requires care in the hospital. A doctor may prescribe drugs to be taken at home. A pharmacist will stock some of the drugs the doctor prescribes, just as they were prepared by the manufacturer. Others he prepares to the doctor's order. A pharmacist has studied many years to achieve the accuracy and precision his work requires. These drugs come with the knowledge of the doctor and the pharmacist, prescribed for a particular problem, prepared in exact amounts, given with precise instructions for a particular person. These drugs may be strong enough to injure or kill, but used correctly, they will help, not harm you. They come from hands you can trust. But can you trust these hands? Can you trust these drugs? You must decide. Why do people without medical problems take drugs? They have other kinds of problems. They want to feel better. Theirs may be problems of loneliness. Sometimes family problems. A problem of having nothing to do. Or perhaps of fitting in with a group which has already begun a drug habit. They call the changes in the way they feel getting high. Getting high may take their minds off their problems for a while, but they will find themselves with new problems. Used by those who know nothing about them, stimulants and depressants, called uppers and downers, can do permanent injury to vital organs of the body, or they may even cause death. Most pills were designed for medical use, but some persons get high with drugs that have no medical use at all. Marijuana, LSD, heroin. LSD may be in liquid or pill form. It is an extremely powerful drug of a type called hallucinogenic. The user experiences the world in an unreal manner. With some, effects of LSD approach the experience of insanity. Marijuana is an hallucinogenic drug. Recent scientific data indicates a possibility of adverse effects on body and mind. So many ways out, but no way out at all. Even the chemicals in commercial products are used by some to serve as drugs, as a way to get high. Ordinary solvents, gasoline, or glue. Ordinary? Only when used for what they were intended. As drugs, just as damaging as any other, just as deadly. Physical damage and death are only a part of the problem. One of the great dangers of drugs is the feeling of need, developing a drug habit. The emotional need to escape through drug use again and again. But whichever drug is taken, getting high just changes the person. The real world we all must live in is still out there. Personal problems are very real problems. But everyone who ever sought escape through the drug habit found their problems still there when they were no longer high. Are drugs for personal problems? Or are they for use through those whose knowledge and skill permit success? Whose hands can you trust? Which drugs can you trust? Only you can decide.